Guys, welcome back to my channel. So today I'm going to talk about this coronavirus. Being a nurse in the healthcare field, I want to know what your opinions are. My views and comments does not reflect those of my employer, but what I would like for you to do, if you have not yet, please subscribe to this channel. Leave any comments, concerns, suggestions below. Hit the bell notification, like, drop a purple heart, anything like that to support me. And let's just get into it.
Hey cousins. So that was an introduction of a previous video that I did almost about a year ago. The disclaimer regarding my employer, that remains the same. But I wanted to do a quick update because my views on COVID-19 versus then and now has changed drastically. So stay tuned.
The coronavirus, COVID-19. So tell me, what do you guys think? Do you think it is really a major health concern that we all need to be concerned with? Or do you think it is a mass hysteria that media is making it out to be? Currently, my opinion, my standpoint is that it's just another strand of the flu.
Girl. Okay, my new opinion is that it is not just another strand of the flu. It's nothing like influenza A, B, swine flu, whatever else we've had in the past. This is something totally different.
It has killed a lot of people in China. If you hear the news, they'll say thousands and thousands of people have died from it. And then they come back and say, 95% of that is in China.
Okay, so we know that opinion has changed because this virus not only affect China, but it is affecting the United States drastically, other countries as well. So in this video, I stated that there was one confirmed death in Washington. I don't know what the numbers are now. So that has definitely changed.
I'm fighting off a cold right now. And the big thing is, oh, do you have coronavirus? I'm like, well, I don't have a fever. That's the first thing that I'm saying. I don't have a fever, so I think I'm kind of clear from that. But then again, it takes a couple of days for the true symptoms to arise.
That's another thing. We cannot just depend on if you have a fever or not. I mean, yeah, a lot of companies, hospitals, we still do it as well. We do check temperatures, but fever is not always the only symptom or not always the first symptom. And some people don't even have fevers. So we can't just go by that. And as we all know that some people are asymptomatic. They may not have any of the symptoms, still have the virus and can still spread it. So back then, yeah, you used to be like, well, I don't have a fever, I'm clear. No, not necessarily. That has changed.
Do you think your floor, your unit, your hospital is equipped well enough? I mean, because on the news, they have the hazmat suits on, like when Ebola broke out. We don't have that at our hospital. I mean, I'm quite sure we have that if it's a natural disaster, like a gas spill or something like that. I'm not sure. But just on an everyday basis, we don't have that. We have, of course, we have these masks.
Okay, so that has changed as well. In the beginning, when we started back in March, our facility went to where everyone had to have a mask anytime that they were on the campus of the hospital, outside, break room, whatnot. You needed to have a regular surgical mask on. Then it went to anytime you're in patient care, you got to have a surgical mask on and some type of shield or goggles. Then as we became merged into the COVID unit, my floor is a COVID unit, or we're an overflow COVID unit. Now we have, of course, we have the N95s as well, like anytime we're dealing with rule outs or COVID patients. But now the COVID floors, we've also been fitted for P100 mask, which is supposed to better protect you against airborne particles. So we have the P100 mask, we have shields, goggles, we have the surgical mask. Of course, we have the our isolation gowns and gloves. And as of right now, our facility hasn't had an issue with running out of stock. That hasn't changed. But as far as the requirement, anytime you walk on our floor, you got to have on a shield and an N95. I have my P100. Everyone doesn't have a P100, I guess, because as the staff changes, the turnover rate, everyone hasn't been fitted. But I have a P100. So what I basically do is I wear my P100 mask, and I'll post a picture of it. I wear that when I'm actually in the patient's room, along with my shield and isolation gowns and gloves. And then when I'm at the nurse's station, I just wear an N95, because you can't breathe in all that stuff for 12 hours or more. You just can't. So we did have to increase our PPE.
I think the news and media is making it a mass hysteria because it's something new. Anything new, we are afraid of it because we are afraid of the unknown, basically.
Okay, so I no longer think that is a tactic to cause hysteria, or that the media is blowing it out of proportion. I really think that it is as bad as they say it is. The thing is that it's not as bad for everyone. So a few that get it and they may have little symptoms or no symptoms, they're saying, oh, they're just blowing it out of proportion. But those who get it and really have bad symptoms or really, die from it, that's not a good thing. So we have to protect everyone because we don't know how your body is going to react to it. We don't know who's going to have what symptoms. We don't know if you have these symptoms, this is what's going to happen to you. I mean, we're, following trends and things, but it's nothing definite. So I think the media has done its job because unfortunately our president, he played it down a lot, and that made it a whole lot worse. So I think that if the media keep putting out, that we need to wear our mask, we need to still social distance, wash your hands, make that a norm, unfortunately, that's going to have to be our norm, then we can combat this virus better.
Now they're actually saying that they're trying to come up with a vaccination like within a couple of months. I've never heard of a vaccination coming out in a couple of months because they have to test it and see if it's effective, and then they're going to have to see if it's affordable. I mean, I don't know, but eventually they will come out with the vaccination, but then, it's going to mutate and it's going to be a different strand, just like the flu has different strands.
Well, today is January the 9th, 2021, and they now have a vaccination. They have at least two different brands. One is through Pfizer and the other one is through Moderna. I think that's how you say it. But as far as how effective it is, they say that once you get both doses, you have to get like your first dose and then wait a couple of weeks to get your booster shot, get the second dose. By the time you get the second dose, you're 95% protected. How true it is, I don't know. I mean, I can only hope that it does what the vaccination is intended to do. How long it lasts, I don't know. Hopefully it's something like the Hep B or the, like the tetanus shot. You have to get it every 10 years to keep it in your system. Hope it's something like that. Or maybe if it's effective and it doesn't cause as much damage, maybe we have to get it every year, such as the flu shot. I don't know. But the thing is that the vaccination has come into play very quickly. So everyone is doubting. Not everyone. A lot of people is doubting it. I do doubt the vaccination myself, but I have to look at it into perspective because I've been praying for some type of relief from this virus, and now is one there. And I just have to believe in the science, believe in God that it would do what it's intended to do. I'm still doing my research. I'm not listening to social media. I'm doing my own research to see, if the good outweigh the bad, pros and cons, and I will go from there. I'm not going to say right now 100% that I'm not going to take the vaccination. So yeah, that was pretty quick. Like I said, I did this video almost a year ago, and they've already come up with the vaccination and it's out in circulation.
Unfortunately, someone did pass in Washington. But far as my understanding, that person had a compromised immune system and they weren't able to fight it off. And that's with any flu, that's with any virus or illness. It depends on your body whether or not you're able to fight it off.
Oh, child. I mean, that part is true as far as with any virus, it depends on how your immune system is, on whether or not it can fight it off or not. But unfortunately, this virus, COVID-19, is not only affecting those who have a weakened immune system. We now know that it affects the old, the young, the sick, the healthy, the very active. It affects anyone, any color, any race, any sex, any religion. It affects anyone. And that's the scary part, is because we don't know who it's going to affect, how it's going to affect, why it affect. We just don't know. And I keep saying, unfortunately, one person died. Y'all seen the news. Y'all know them numbers. Them numbers are high. And I'm speaking of in the United States, not China and the other countries. In the United States, in Jacksonville, Florida, our numbers are high. Our numbers were high in July when the spike initially hit. We're in our second spike, and we've already surpassed the July numbers. And this is in Jacksonville, Florida, Duval County, just to put it in perspective.
The best line of defense is hand washing. Proper hand hygiene is the number one. Hand sanitizers are flying off the shelf, and those are cool. You know, when you're out and about, you don't have anything else, you don't have access to soap and water. But soap and water is the best thing.
Okay, so yes, I'm still a firm believer in hand washing. Proper hand washing is a valuable tool in combating this virus. When I say proper hand washing, I mean wash it with soap and water at least 20 seconds, say your ABCs twice or something like that. But along with that, we now know that you need to wear your mask and you need to have some social distancing between yourself and someone else. That is the way that those numbers began to come down. But unfortunately, now that it was Thanksgiving, Christmas, we had a lot more gathering. It's colder outside, so we're inside. Those numbers are creeping back up. So those three things is what we have. Besides the new vaccination, we have hand washing, wearing your mask, and social distancing. And I believe that that is working.
But leave your suggestions, your comments below. And tell me, what do you think? Is it really as serious as they trying to make it out to be? Or do you think it's just hysteria that the media is causing?
So overall, I think that my opinions have changed. It is as serious as the media is trying to portray it. I've seen the deaths. Unfortunately, I've had family members that has been affected by it. I had church members. I mean, so I've seen the effect personally and professionally. And unfortunately, like I said, there's no trend. So I say that, yeah, it is as serious as they are trying to make it out to be, and we need to act appropriate. That's my opinion, and this is my updated version. Who knows? It may be updated again within the next 5 months, because I don't think the virus is going anywhere. I don't know. But leave your thoughts, your comments, your concerns. What do you think? Do you think it's still a mass hysteria? Do you think it's as serious as the media is making it out to be? Do you plan on taking the vaccination? Have you already taken it? Because it's been out now for a while. What do you think? Just leave your comments below. Hit the like button. Subscribe to my channel. And I'll talk to you guys later. Peace.